hospital, so it's still important to get vaccinated now. Next, I'd like to re-emphasize some of the recent data and news that's been circulating over the past few days. As you know, last week we began reporting COVID-19 cases among K-12 students and staff. To date, we have seen a total of 287 cases in our schools since we started tracking this data on August the 2nd. This includes 226 cases among students and 61 cases among teachers. We also received a report of a death of a 16-year-old child prior to the start of school, according to the Lancaster County School District. I hope that those focused on children being more likely to have mild illness will reflect on this tragic news of a 16-year-old child dying from COVID. Across our state, residents are mourning another loss. An Horry County School Board member died due to COVID complications earlier this week, and that came after the vice chairman of the school district suffered a COVID-related death in January. Further deaths can be prevented. When you consider that we're barely 2 weeks into the 2021-2022 academic year, the reality of school without all the available protective measures is scary for our children and for our teachers. Many of our students are too young to get vaccinated, and so they must rely on older family members and friends to keep them protected through vaccination and having them wear masks themselves. Unfortunately, this hasn't been the case, which is why we're seeing this troubling start to the school year. And this is not shocking. Science has shown us that a virus with one or more highly transmissible variants combined with large groups, low vaccination rates, and less masking creates a breeding ground for infection. We must increase our masking and our vaccinations if we want to stop the surge in cases and move back to normal activities. Our most recent data continue to show us how important vaccinations are. In July, 88% of cases, 77% of hospitalizations, and 79% of deaths were among those who were not fully vaccinated. We have lagging vaccination rates and higher transmission due to the Delta variant. But even with those factors, data confirms that being vaccinated reduces the chances of contracting COVID-19 and it slows the spread. During hundreds of interviews over these last many months, I've tried to find the best way to provide information to help people to protect themselves. And I have to say again that COVID is killing our loved ones, and it doesn't care how old or young you are. A majority of the deaths that have been reported could have potentially been prevented. Please get vaccinated. Please wear your masks. Please practice these other safety protocols so that we can finally end this pandemic and stop losing lives unnecessarily to this deadly virus. Thank you.
Thank you, Dr. Bell, for that. Now we're going to go through the pre-submitted questions for Dr. Bell. The first one that we have is a $100 cash incentive to take the vaccine in the Houston area is said to be spreading like wildfire. Should South Carolina do something like this, or at least give away lottery tickets?
Our General Assembly considered incentives for COVID-19 vaccination, but the legislature did not adopt any provisions that would establish or authorize COVID-19 vaccine incentives. So while DHEC is not offering incentives directly, we have worked with community partners to provide incentives on a smaller scale. DHEC wrapped up its Shot with the Chaser campaign last month, which offered a free beer or soda to those who received a vaccination at the partnered breweries. And while these types of incentives have helped in many settings, effective ways to increase vaccination rates is through people following guidance from credible sources and making informed choices after weighing the risk of the disease and the benefits of the vaccine. We hope that that continues and that our residents will decide to get vaccinated and protect themselves and their loved ones. from severe illness and from deaths.
Next question is, if the White House and/or CDC officially announce a recommendation for all people to get a third Pfizer or Moderna shot, which is what we've seen, how soon do we anticipate South Carolina will start offering them? Will there be a phase-in like the initial rollout, or can anyone get one anytime?
Well, just as the CDC is making plans for the administration of booster doses, our DHEC planning and logistics staff maintain close collaborations with healthcare providers, with practices and other vaccination sites and community partners to ensure that we will be prepared for doses to be administered in South Carolina in keeping with whatever the approved recommendations are. A phased rollout in South Carolina has not been discussed to my knowledge.
Dr. Bell, I have a school question. If a child in a class tests positive, should the entire class be sent home for quarantine for 10 days? And if a child is sent home as a close contact, should that child's siblings also be required to stay home from their classes and quarantine with that child?
Per DHEC's school guidance, fully vaccinated people and people who have been infected with COVID-19 in the previous 90 days and who are a close contact with cases do not need to quarantine as long as they don't have symptoms. Individuals may choose to provide documentation of their full vaccination status to eliminate the need for quarantine. And fully vaccinated people are recommended to get tested 3 to 5 days after an exposure, even if they don't have symptoms. And it's important for them to continue to wear a mask at school until 14 days after their exposure, or they have received a negative test result. Children who are not fully vaccinated and who are not known to have been infected in the previous 90 days do need to quarantine for 14 days. The entire class does not need to be sent home, only the close contacts. There are options to shorten a quarantine period to 7 or 10 days, but schools, schools may decide whether or not they're going to adopt those options. If a child is sent home as a close contact, they should distance from siblings, but the siblings do not need to quarantine because they are contacts to a contact. They are not the contacts to a case.
Our next question, Dr. Bell, what do you read to get more information about COVID-19? What news sources, academic sources, etc.? It could be helpful for residents to know. For example, at a local government meeting Tuesday night, one person said that SARS-CoV-2 is computer generated.
Well, I read publications from the CDC and information that is posted on their website. I also monitor studies that are published in peer-reviewed medical journals. And while I watch the news, I don't use news sources for information that I share unless I verify that the original source is from a credible source like a peer-reviewed publication.
Thank you. Next question is, given the greater contagious nature of Delta, do we need to be more concerned about the possibility of transmission from surfaces? Should wiping down mail and groceries be done again?
Well, wiping down surfaces, hand washing, and other safety protocols are still strongly encouraged, especially with the rise of the Delta variant. But there's no need to wipe down mail and groceries and surfaces that you touch. It's more important to keep your hands clean than it is to try and clean everything that you may touch. The most common mode of transmission for this respiratory virus is actually through inhalation. And the most effective way to stop the spread of the Delta variant is vaccination and consistently and correctly wearing a mask to prevent the inhalation of the virus that causes disease.
Dr. Bell, does DHEC have a position on the safety of air travel given the spread of the Delta variant?
We follow the CDC guidance, and the CDC is still encouraging that those who are not fully vaccinated delay travel at this time. If those individuals do decide to travel, the CDC recommends taking a viral test 1 to 3 days before the trip, and if you're positive, you should not travel. that individuals should wear a mask and practice physical distancing during their travel, and they should get tested after the return from travel back home to make sure that they're negative, and they should avoid contact with other individuals until they have a negative test.
Dr. Bell, what are the most common places people are catching COVID? Restaurants, bars, grocery stores, offices, private parties, or random outdoor encounters?
When there's widespread disease activity like we're experiencing right now in the state, identifying where COVID was contracted in a specific individual is not always possible, because people are moving around and they can potentially visit many of the venues that you're asking about, and we can't determine where they may have been when someone else who was positive with COVID may have been present. So we may not be able to establish the original source of infection in many, because it might not have been the last place that they visited. We are, however, able to document significant transmission within households. And it's important to remember that COVID is present in our community at a high level in the majority of our counties now. And this is as per the CDC level of community transmission webpage that you can visit. You can hover over each county and you can see what the disease rates are in your county. DHEC contact tracers do investigate cases of COVID that are reported to us and provide guidance to the close contacts of those individuals, or when we see transmission in facilities, we provide facility level guidance regarding mitigation measures that can be taken to limit further disease transmission.
Our next question is, does DHEC still believe in the 6-foot rule for social distancing, or does the extra strength of Delta call for wider separation?
At this time, there have been no updates to federal guidance on how far individuals should distance from each other to be considered a close contact, or to avoid being a close contact, I should say. So DHEC is still encouraging that 6 feet of physical distancing be maintained, as well as masking for everyone over the age of 2 when they're indoors and in public settings in areas with substantial and high transmission. And again, this is in the majority of our counties. In school settings, our guidance is to maintain 3 feet of physical distancing.
Next question is, when a member of the general public decides they want to get a 3rd shot, when can they do so? And can you explain the recommendation to wait 8 months?
Well, right now, only immunocompromised individuals are recommended to receive that 3rd shot. We are aware that the CDC is developing a plan for the 3rd shot to begin later this year. And people will be able to get those booster doses in the same types of settings that are available now in physician practices and retail and chain pharmacies, etc. The rationale behind the recommendation to wait for that 8 months is based on data that was shared by the CDC just today that we are currently reviewing. And it's based on numerous studies that showed waning antibody titers over that 8-month period. They have noted that there's nothing actually magical about the 8-month period, but they want to make sure that people are prepared and that will be protected if immunity begins to wane around that time frame, that they'll have plenty of time to get booster doses so that over time, if immunity is waning, they won't be caught unprotected and they will maintain the protection of the reduction of severe disease, remain protection against the hospitalizations, and they will maintain protection against the deaths. And that's the rationale behind that 8-month period.
Will people who received the 1-dose Jansen shot also need a booster?
Studies are still examining the efficacy or the need of a booster dose for the Jansen vaccine. Those are being conducted right now. But the emergency use authorization that the FDA amended to allow for the 3rd dose for immunocompromised individuals is only for the Pfizer and Moderna vaccines at this time. And based on available data, there's no recommendation or allowance for an additional dose or booster dose for people who received the Jansen vaccine. DHEC will continue to monitor the FDA and the CDC's authorizations and guidance, and we will provide recommendations based on those authorizations, those recommendations for South Carolinians when they become available.
And two more questions we have that were pre-submitted. One is, in the upstate, we've already seen one district make the decision to go virtual just 9 days into the school year. How is the Delta variant changing back to school this year compared to last year?
We're seeing an increase in K through 12 cases this year from last year because of the increased transmissibility of the Delta variant. And additionally, because of the lack of the same prevention measures being in place that we had during the last school year. So those two factors are contributing to the high rate of diseases that are being reported in just the first few days of school. This is incredibly unfortunate, and we hope to see those numbers decline with layered prevention measures being used in schools, parents adopting those prevention measures that are recommended at this time. We have the science and the data to show us that the masks work and that the vaccines will also lower cases. And until we have that in place, we remain very concerned that we will continue to see high rates of cases, and this, of course, will result in more hospitalizations and will unfortunately result in more deaths if we don't follow the prevention measures.
And our final pre-submitted question is, with a booster shot going to be recommended 8 months after a person's second dose of the vaccine, is that time frame unprecedented? Are there other common vaccines that require a booster just after a few months?
That time frame is not necessarily unprecedented. There are numerous vaccines that require booster doses, and a couple that come to mind are a tetanus shot. We recommend booster doses for adults every 10 years because of waning immunity and waning protection against that. The time frame for that 10 years is based on the performance of that particular vaccine. We also recommend there be booster doses for the pertussis, or the whooping cough component of that same vaccine because it comes as the tetanus, diphtheria, and pertussis shot. We know that we must protect newborns who are at highest risk of complications from tetanus, and this is an excellent example where we recommend that the close household contacts, that the mothers of newborns be vaccinated against whooping cough, not because they suffer from serious complications, but because they must protect the young babies who will suffer from severe complications. And so we're asking to do a similar thing with our COVID-19 vaccine. We want to protect people who may not themselves have severe complications to protect others who may. The meningococcal vaccine is another example where we want to get our students boosted when they're approaching an age where they may enter college, because they will be in a high-risk environment and a congregate setting in dormitories. And we see devastating cases of meningococcal disease. Although they're rare, we still recommend that booster dose for all children before they go to college. And of course, we want to get an annual flu vaccine because of waning immunity and because of changes in the predominant strain that will circulate each flu season.
Thank you so much, Dr. Bell. Before we open it up for live questions, I just want to remind everybody that the purpose of this briefing is to inform and educate the public on the status of COVID-19 in South Carolina and to answer any questions you may have about it. Any requests or questions about issues other than COVID should go through our regular media relations channel at media@dhec.sc.gov. If you have a question, please raise your hand, as Dana has already done, and I will recognize you. And make sure, if you can, please state your name and your outlet for clarity. And I'll add that a recording of today's briefing will also be available later on this afternoon on our YouTube page. And I'll start with questions. And Dana, you're up first.
Hey, Dr. Bell, Dana Lynn McIntyre, the Augusta Press over here in Georgia. The rising school rates, kind of disturbing to hear those numbers. At what point do you think, and I know this is crystal ball, at what point do you think maybe DHEC and Superintendent Spearman go to the governor and the legislature and say, y'all have tied our hands, we cannot do this?
Well, we and the Department of Education continue to work closely with the governor's office, providing updates, and I'm sure that we are providing the latest data The governor's office asked for that information for a reason, and that won't change. We will continue to work closely with the governor's office, providing the guidance that we know will protect individuals from the spread of disease.
Zach, go ahead, please, sir.
Yes, thank you, Dr. Bell. I appreciate your time today. I had just a couple questions about the boosters. The first one was, how concerned is DHEC about some people who may have been difficult to reach just to get the initial doses will be tough to reach for boosters? And is the agency planning to do anything to reach out to people who have received two doses of the mRNA vaccines, send them, postcard reminders or anything like that to encourage people to get booster shots?
Right, thank you for that question. And we know that people who are already vaccinated are still pretty well protected. Our concern is that that's waning over time. And so for those individuals who are unvaccinated, who currently have no protection whatsoever, is a great concern. And I don't know if the rising trends in disease rates will change minds, if people will feel more confident over time with more and more experience with the vaccine, particularly the safety profile. We're hoping that that is what some people are waiting on, and have said that, so that over time they will be convinced. We are looking forward to the FDA approval of the vaccine that many people say they're waiting for, even though there's not really significant difference between the current emergency use authorization and waiting on that final FDA approval. So all of these things we're hoping will change the minds of those people who are not yet protected at all. What I'm hoping is that they will not wait for more complications, especially we often see people wait to the point where something serious happens to a close member of their family, or that we have more deaths. We are not looking for these bad outcomes to change people's minds. We're looking for information to provide to people that will tell them, please get vaccinated before it's too late. You have an opportunity to prevent those bad outcomes. And so the messaging, we appreciate the help from the media getting these messages out. And that is our hope, that we will not have even more barriers to people who are not yet vaccinated while we're trying to enhance protection for those who are.
Thank you, Zach. Patrick Lloyd, you're up, sir.
Hey, Dr. Bell, thank you so much for your time. Patrick Lloyd with WMBF News in Myrtle Beach here. Just wanted to ask, I know it's obviously hard to predict the future with what's going on here, but I did want to ask, thinking, maybe, I don't know, a few years down the line when it comes to these shots, do you expect the vaccine for COVID to be kind of similar to like the flu shot, where people are going to be recommended to get it, at least once a year, like the flu shot is recommended right now?
Well, as you pointed out, it is hard to make those projections because we don't know how this virus will behave. If we get to a point where this disease is considered to be what we call endemic, meaning it will continue to circulate at a certain level in the population, we think that, we expect that. We hope that will be a very low level. And if the coronavirus changes over time from one year to the next, like the flu virus does, then we may see the need for annual dosing to get the best protection in the population. It's really hard to say.
Thank you, Patrick. Dana, go ahead, please.
And Dr. Bell, you touched on this last week, and you kind of just touched on it now. Can you talk again about why vaccination is so important? The Delta variant came from somewhere. The Alpha variant came from somewhere. Talk again about the concern that unvaccinated, moving through the society, more possibly worse variants developing.
Yeah, thank you for that question. And a couple of points. We continue to reinforce the need for the use of masks, but that relies on the correct use, the consistent use, and the reason for the importance of vaccination is because it gives your body the ability to protect you without you having to think about it. You don't have to think about where your mask is. if someone next to you is wearing a mask or how far apart you are from someone, because your body's immune system will respond and fight against the virus, especially against unrecognized exposures. Now, the worry is that the vaccine that we have now, and as we're actually considering, is that we will have waning immunity over time. That's one concern for the current strains that are circulating. We know we have pretty good protection, at least for now and at least for many, many months. But if we don't get better control of the high disease circulation in the communities right now, if the virus mutates to a strain that we don't have protection against, then we will be in a completely different environment where we have very limited options for building people's immune systems using a vaccine. We will, and I know vaccine manufacturers are actually poised to tweak, especially the messenger RNA vaccines, because they work based on targeting the proteins on the surface of these viruses. And so it gives us the ability to tweak those vaccines and offer protection against the currently circulating strains. What we hope we won't see is people questioning that science and questioning the modifications of the vaccine to offer the best protection. And they're not saying that, well, was this developed too rapidly to give us the protection? I'm concerned about those questions that are being raised now, and we've lost some opportunities, lost a great deal of time when we could have really suppressed the curve had more people adopted the vaccine earlier. So thank you for that question.
Zach, go ahead, please, sir.
Thanks. Yeah, Dr. Bell, another question about boosters. Does DHEC have plans with respect to providing booster shots to long-term care facility residents, some of whom presumably are immunocompromised and therefore would be eligible already, given that previously these residents were vaccinated through a federal pharmacy partnership that I don't know if it still exists or will be coming back for the boosters?
Yeah, so I can't answer that if original arrangements that we had to achieve high coverage in all of our nursing homes in the state early on, if those will be implemented again. But what we're continuing to do is working with all the nursing homes to encourage that they get their residents vaccinated, especially these new admissions. The existing residents who may have, we know that they're in these facilities for many, many months, and yes, they may be among those who are immunocompromised. Now, we do want to make the point that being in a nursing home, that in and of itself, even though these people may suffer from chronic illnesses, that does not meet the definition for being immunocompromised. We want to encourage the staff members who work in these facilities, who are in and out of the community, being among the most important to be vaccinated so that they don't introduce new infections into this vulnerable population. Even though they're not immunocompromised, we see high rates of disease in these facilities because they're congregate settings and people live there and cannot avoid exposure.
Patrick, you have a follow-up, sir.
Yes, thank you. I just wanted to ask something, Dr. Bell, about something that you mentioned earlier. You said when it comes to kids getting COVID in school, the entire class does not need to be sent home, just the close contacts. Just wanted to follow up on how close exactly you mean. Are we talking about kids who are like their desks are just directly to the student who tested positive, or what exactly do you mean by that?
Yes, in a school, we say within 3 feet to be defined as a close contact. And so we would not say that the whole class had to be quarantined. Only those in that close proximity for at least that 15 minutes, which happens frequently in the, is in the classroom setting. 15 minutes of cumulative contacting as being that close contact within 3 feet.
There being no further questions, Dr. Bell, I wanted to thank you so much for your time today, and to all of our media members and friends, I want to thank you all for your time today. We depend on you, we rely on you, and we appreciate you. Thank you so much for being here today, and we will see you next week.
Yes, I thank you too. Thank you, Ron, and everyone.